If your first few steps out of bed in the morning causes stabbing pain in your heel, you could be suffering plantar fasciitis.
Plantar fasciitis is a common condition. Dr. David Lovelace with Alliance Health in Durant explains.
Ask the Doctor is sponsored by Alliance Health, Durant.
Hello, I'm Dr. David Lovelace. Plantar fasciitis involves the inflammation of a thick band that runs across the bottom of the foot that connects the heel to the toes. Pain is typically worse first thing in the morning or after a period of physical inactivity. Plantar fasciitis is quite common, with an estimated 10% of Americans experiencing the condition at some point in their lifetime. It is most common in adults between the ages of 40 and 60. Risk factors that increase your likelihood of this diagnosis are being female, running as a sport or hobby, being overweight, having a job that requires a lot of walking or standing on hard surfaces, though in many cases the cause of plantar fasciitis isn't clear. The condition typically starts gradually with the sensation of mild pain at the heel bone, often referred to as a stone bruise. The patient is more likely to feel the pain after as opposed to during physical exercise. Plantar fasciitis is a fairly common and treatable overuse injury, but left untreated, it can become a chronic condition that prevents you from maintaining your activity level. It can also lead to knee, hip, and back problems because plantar fasciitis can change the way you walk. Footwear with proper arch and heel support is the best way to try and prevent foot pain and injuries. But if you find yourself with a diagnosis or suspected case of plantar fasciitis, there are some steps you can take at home. First, consider keeping weight off your foot until the initial inflammation subsides, applying cool packs to the painful area in 20-minute intervals throughout the day. Finally, stretching exercises for your Achilles tendon and plantar fascia are by far the best treatments to address the injury and prevent reoccurrence. If you have foot pain, don't write it off as something you just have to live with. Talk with your primary care provider about any issues that restrict your mobility or quality of life. For Alliance Health Durant, I'm Dr. David Lovelace.